welcome to one of my favorite topics, stem cells and PRP, regenerative medicine, definitely one of my favorite topics. By the way, make sure you get my ebook, which is free, at albertorullan.com about equine regenerative medicine. Here I'm going to explain you, in this book I explain you everything you need to know to this date, because this topic evolves almost every month, every week. So to this day, the most common regenerative methods in the market. Now, for the purpose of this lecture, I am only going to talk about the difference between PRP and stem cells. The reason I want to expound on this topic quite a bit is because it's actually quite controversial to this date. For some reason, they get confused. And here I am to make sure I clarify everything. PRP stands for platelet-rich plasma. All right, one more time. Platelet-rich plasma. Stem cells is something completely different. Sometimes they get used interchangeably. Let me tell you how we process it. That way you understand the main difference between them. Basically, what we do in order to get PRP, we get blood from the horse, the person, the snake, any animal, and we put it in a centrifuge. And literally what we do is we go around like that thousands of times at certain RPM, which stands for revolutions per minute. And then once you turn it around so much, it's going to come like this, where you separate the red blood cells from the white blood cells, or the buffy coat, which is right here, and the plasma. Now I'm going to repeat the parts. Right here in red is the red blood cells, or RBC. Right here is the buffy coat. And right here is the plasma. So in order to get platelet-rich plasma, we need to find out where are the platelets. Well, platelets are not here because this is red blood cells. Platelets are going to be right here in the buffy coat. We take this buffy coat and we mix it with a little bit of plasma, and you know what you get? Rich plasma. As simple as that. Isn't that cool? So simple. We use that anytime we have any anti-inflammatory, anytime we desire anti-inflammatory techniques for ligaments, for tendons, for joints. And some people have been using it lately for eyes, whenever they have eye issues. If you go to your some of your cosmetic doctors, some people are using it for wrinkles, and some people are using it for healing wounds, etc. Now, why do they do that? Because the platelets, which, by the way, do you know what the platelets are made for primarily in the body? They create a clot. Whenever you cut yourself, platelets are going to go there, travel, and start creating the main clot so you don't bleed out. So that platelet also have growth factors, and those growth factors are excellent to increase healing. They also have some anti-inflammatory properties. All right? That's why those platelets are so good. Now, let's think about stem cells. Where are stem cells in the body? Absolutely everywhere. All through your body, all through your animal's body, there's a lot of stem cells. Now, there are some areas that have more stem cells than others. Let me give you an example. Where are all red blood cells, all the blood cells made? They're made in the bone marrow. The bone marrow, I'm sure you know this, but I am going to just making sure that we are on the same page. Let's pretend this is a bone. The bone has an inside part right here. That inside part is called the bone marrow. And in that bone marrow, there's a lot of stem cells that produces red blood cells, white blood cells, and other things. Back in the days, researchers used to drill or make holes in the long bones, like right here, for example, or the femur, or the hip, and draw cells from there, culture them, and then get the stem cells out, right? Now that we discovered that there are stem cells everywhere, some of researchers found out there's stem cells on fat. So right here, right underneath anyone's skin, there is fat. There's a lot of stem cells over there. There's a lot of stem cells in the teeth. There's basically stem cells everywhere. So researchers have found the ways to get those stem cells out. And what do those stem cells do? They become other cells. For example, a stem cell can become a cell for the heart, can become a cell for the tendon, can become bone, can become blood, like we talk in the bone marrow, can become fat. So this really cool mechanism helps out because they are used to heal all these areas. For example, a good friend of mine, he came from Germany, and he's one of the first surgeons who discovered that you could take stem cells and repair heart. Isn't that cool? So they take dead heart tissue from they put stem cells on the heart, and they get better. Super cool. How we use it in horses? Most commonly, we use it to create new tendons. A lot of times, we use it to create new bone or help bone on fracture repair. Now we also use it for ligaments, and we also use it for wounds. Now, before I forget, the stem cell market has actually changed drastically from 10 years ago. Now, we don't only get it from bone marrow or from fat or from teeth, but very nicely we can also get it from placenta, from other horses who are actually not related to the horse that you are going to treat. And that is kind of revolutionizing the industry a little bit, because you can order stem cells. You can call a company and say, hey, send me stem cells for this horse. And guess what? You can use them. Back in the days, when you get it from fat, when you get it from bone marrow, you should use it, or you have to use it from the same horse. But researchers have found out that when you use it from placenta and prepare properly, you actually can use it from other horses. Isn't that cool? All right, I hope you have at least a good introduction of the main differences between platelet-rich plasma and stem cells. Now, if this kind of bores you a little bit because you're way advanced, don't forget, you can always call me or text me, and we can get into real depth conversation about everything that is more complicated than what I just explained, all right? But for the purpose of what I'm teaching you right now, this is all you need to know, and your clients as well. You have a great day.